So kia ora, thank you. It's great to be a part of this webinar. So working on this diagnostic project has been one of my key roles since starting at Autism New Zealand about a year ago. So it's exciting to be at the stage of actually sharing our results. And the project, of course, wouldn't be possible without support from the Autism CRC and collaboration with Kaya Evans and her team at the University of Western Australia, as well as other researchers and clinicians in New Zealand. So Autism New Zealand saw this research as really important for people on the autism spectrum and for those who work with them, because we understand that diagnosis is a critical point that can have long-term impacts on an individual's life, as well as for their family and whānau. And over the years, we've also heard countless stories about the diagnostic journey, like the ones on the screen, and similar sorts of stories around differences in assessment processes between individuals and across the country, as well as that the post-diagnostic support can be fragmented. However, we also know that there are many great clinicians who are really passionate and doing their best to provide best practice diagnosis and care, and that at times they can be hampered by systemic barriers, lack of funding and resources. So this research really gave us a chance to see what was happening from a range of different perspectives. And in New Zealand, we do have an autism guideline, and we've had this in place since 2008, and it's updated annually on different topics. And the guideline was created to help clinicians make decisions during that identification, diagnosis, as well as ongoing support through the lifespan. However, we've often heard from the autism community that there's quite a difference between what is recommended in the guideline and what's actually received. So Autism New Zealand led this project to more formally investigate that existing diagnostic landscape, as well as the uptake of the guideline that we have in place. And we really wanted to provide quantitative and qualitative data about people's actual experience of the diagnostic process, as well as inform recommendations for improving best practice in the diagnosis and care. So we developed 3 surveys, one for children who were diagnosed with autism during childhood, one for adults who were diagnosed in adulthood, and one for clinicians who were involved in the actual diagnosis of autism. And we were really pleased with the responses that we received, so 640 in total across the 3 surveys. And across those surveys, all of the regions of New Zealand were represented. And nearly all of the responses on behalf of children were made by parents. So we broke up the diagnostic process into 3 key phases. First of all, looking at that identification and initial help sort, then looking at the actual diagnostic process itself, and then post-diagnostic support. And we've included some actual quotes from respondents in some of the slides, so when they pop up, I'll give you a moment to read those yourself and digest those. Looking first of all at that pre-diagnostic stage of identification and initial help, it was unfortunately characterised by a lack of clarity and delay in the process. So here's what one parent said, but was echoed by many. And for both children and adults, we found that the pathway to pursue a diagnosis was unclear, with less than a quarter saying it was clear, as is indicated in the figure by the dark blue and turquoise colours. However, that story around the actual process was quite different between diagnosis in childhood and adulthood. So looking at children, we found that on average, they're not identified until 4.5 years. And when parents did seek help, they were often guided down paths that delayed that diagnosis, so by being told things like there wasn't a problem or to come back if there wasn't any improvement. And so as a result, we found that on average, children weren't diagnosed until 6.4 years of age, which demonstrates a 1.9 year gap between those initial queries and the actual diagnosis. And so this means that too many children are missing out on the opportunity for effective early intervention. And then looking at adults, we also saw a big gap between those first queries about possibly having autism and actually getting that diagnosis, so about a 4-year gap. But with adults, when they initially sought help, 2/3 received a diagnosis at that first point of contact, indicating a faster process for obtaining an actual autism diagnosis in adulthood. And looking at the diagnostic process itself, clinicians indicated a good awareness of the New Zealand guideline, but there was some variability in implementations of recommendations that are made in the guideline. So as a result, we found different experiences in the diagnostic process between childhood and adulthood, as well as between public settings and private practice, as can be seen by these two respondents. So for children, we found it was a long time to receive a diagnosis, where the time from when they're initially placed on a wait list for that first appointment to actually receiving a diagnosis was 10.9 months on average, whereas for adults, this was a lot faster at about 4.8 months on average. And these time differences are likely because we saw that 72% of children were diagnosed in the public system, whereas adults were clearly underserved by the public system, with 71% being diagnosed in private practice. And so the slower speed is likely due to a range of factors, but probably demand being too high for the resources available in the public system, as well as the approach taken, where we found that children who were assessed in the public system had more clinicians involved in the diagnostic process, with a comprehensive multidisciplinary approach being undertaken 82% of the time, which is recommended in our guideline. Whereas adults diagnosed in private practice are more commonly assessed by a single clinician, so that happens about 2/3 of the time. And despite these differences in the processes, there were some common positive experiences when clinicians took a really thorough consultative approach. Overall, we found moderate satisfaction with the diagnostic process. And even though there was a cost for diagnosis in the private setting, the satisfaction was actually higher in the private setting for both children and adults compared to the public system. And this satisfaction was linked to less stress during the diagnostic process, to greater satisfaction with the initial help that the person received, with the manner of the clinician, with involvement of fewer clinicians in the diagnostic process, and shorter wait times to receive a diagnosis. And overall, really promisingly as well, as the satisfaction was higher than what we've seen in similar research in other countries. Unfortunately, post-diagnostic support was characterised by poor experience. For children and adults, only about a quarter were satisfied with the post-diagnostic support, and very few indicated that the post-diagnostic supports were well coordinated, as the parent in this quote reported. So common experiences suggested that there was a lack of support, in a sense that people had to deal with it themselves. often being given pamphlets but no real support, or when support was available, there are often delays in accessing it. So there was widespread dissatisfaction with services and resources, both for children and adults. And we found notable areas of dissatisfaction included counselling to adjust to that diagnosis, as well as vocational support, both for children and adults. And then there was also particular dissatisfaction with some government funded services. So for children, this was early intervention and school support through the Ministry of Education. And in adulthood, this was disability support services through the Ministry of Health. Within the New Zealand context, it's also really important to adequately meet the obligations outlined in Te Tiriti or Waitangi, which is our founding document between the government and Māori. And in terms of cultural support provided during that diagnostics process, we found that these obligations aren't being met adequately. So even though the cultural support for Māori and Pacific respondents wasn't actually needed about half of the time, where people did see that they needed that support, it was commonly not provided, as you can see in the purple bars of the figures on this slide. Promisingly though, there was more satisfaction with clinicians' sensitivity to cultural needs. Overall, results from this project show that some things are going well, but there's always room for improvement if we work together and are also supported by government. And so to do this, we see that the development of national and local collaborative stakeholder groups to lead New Zealand's long-term approach to autism are needed, and that these groups could ensure that changes are made in each of those three key phases of the diagnostic process. So earlier identification and clarity in the diagnostic pathway to ensure that the diagnosis happens sooner and more children have access to early intervention that we know plays such a critical role in development. Then to support consistency and timeliness of the diagnostic process through further development and uptake of our New Zealand guideline. And so that can be both on a clinical as well as a system level. For example, the guideline actually does recommend a pathway in the public system for diagnosis of adults, but clearly the results from this project show that this isn't happening. And so development of such a pathway could be achieved through co-design between key stakeholders who are involved in the process, such as autistic adults and clinicians who make the diagnosis, to ensure that it takes a really consultative and strength-based approach that we know positively influences experience. And finally, there's a lot of work that needs to be done around that pathway for post-diagnostic support. And this could be informed by a really comprehensive needs assessment that's done earlier in that diagnostic process to ensure earlier access to ongoing support. So thank you everyone for your time.